Let's start with a question that sounds, well, completely backward. What if fixing US healthcare could actually crash the entire economy?
We all know the American healthcare system is famously broken. But what if the cure is actually worse than the disease? What if a sudden aggressive fix could trigger an even bigger crisis?
Okay, first, let's cover the facts we've all heard before. The US spends nearly double what other advanced economies do on healthcare. But for all that money, we get measurably worse outcomes, things like lower life expectancy and higher infant mortality. It's a paradox we're all pretty familiar with.
But the story here isn't just about the quality of care. It's about the sheer scale of healthcare as a piece of the US economy. And this is where the problem gets really, really complicated.
Get this. By 2033, it's projected that healthcare will make up 1/5 of the entire U.S. economy. Think about that. That's 20 cents of every single dollar spent in the country.
So, where is all that money going? We often think of doctors and nurses, but they're just a tiny fraction of the story. Out of the 20 million people working in healthcare, fewer than 1 million are physicians actually providing direct care. The rest? They're part of this massive administrative machine. And this spending, it completely reshapes our whole economy. We hear a lot about American consumerism, right? But here's the thing. If you take healthcare out of the equation, our spending looks just like other developed countries. A huge chunk of what we call consumer spending is really just the high cost of healthcare. Now, this bloat, it isn't just random chaos. It's the logical result of a system where all the different players are just acting in their own self-interest, creating a structure that's, well, perfectly designed to be inefficient.
And that brings us to this powerful, kind of unsettling idea. What if the system isn't broken at all? What if it's working exactly as it was designed to, based on the incentives of everyone involved?
Think of it like a hopelessly tangled knot. Doctors have massive student debt, so there's an incentive to limit the supply of new doctors to keep wages high. Hospitals want more market power, so they emerge into these huge regional monopolies. Insurers have to manage financial risks, so they create all those administrative hurdles. And pharmaceutical companies, they want to maximize profits, so they charge Americans the highest prices in the world. Each group pulls on their own little string, and the knot just gets tighter and tighter.
And this is how that knot stays protected. The healthcare sector is the #1 lobbying spender in the entire country, putting up nearly $750 million a year at the federal level alone, just to make sure the system stays exactly the way it is.
So now we get to the very heart of our question. What would actually happen if we tried to instantly cure this system? What's the real economic price of making it efficient?
Okay, let's just do a little thought experiment. Imagine we could just snap our fingers and replace the whole US system with an efficient one. Let's say something like Australia's, which also uses a mix of public and private options. The result would be absolutely staggering. A rapid fix like that could shrink the US economy by 7.5%. For a little context, the 2008 financial crisis caused a shock of just over 4%. So the cure in this scenario would literally be a bigger economic catastrophe than the Great Recession.
And that's not just some abstract number on a chart. It would mean millions of those administrative jobs would just vanish overnight. It would mean massive instability in the financial system that's built around all this spending. It would mean, in short, a deep and immediate economic recession.
This realization, it forces us to reframe the entire problem. Maybe the goal isn't a fast, dramatic fix. Maybe we've been asking the wrong question all along. So the challenge, then, isn't demolition. You can't just detonate 1/5 of your economy, no matter how inefficient it is. The real challenge is a careful, gradual untangling. So what could that untangling look like? Well, it's not one single policy, it's a series of smaller, deliberate steps. Things like actually enforcing antitrust laws to break up hospital monopolies, reforming lobbying rules to reduce all that industry influence, and mandating real price transparency so we can all see what we're actually paying for. These are the kinds of steps that slowly loosen the knot, instead of just trying to cut it and causing a crash.
So, you see, the problem isn't just a broken healthcare system. It's a system so deeply woven into our economy that fixing it requires a completely different approach. The real question isn't how to fix healthcare, it's how do we untangle it to build a healthier economy for everyone.